Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi everyone, I'm Dr. Mitch Ghen, and I want to talk to you today about the endothelial lining. Pretty much the propagation or development of coronary vascular disease lies in the integrity of the endothelial lining. Now, that's the one cell lining of approximately the 64,000 miles that makes up our vasculature. Now, its disruption over time is responsible for embolic strokes, myocardial infarction, of course, the development and buildup of calcium in the arteries as well as other plaque material. The endothelial lining is particularly impaired by several things. For example, obesity, hypertension, diabetes, cigarette smoking, hyperuricemia, and the aging process itself. Now, all of these, either one or several mixed together with other noxious substances, could create a problem in this lining, which could lend itself to an increased risk of heart disease or stroke. Now, the early diagnosis and effective intervention is essential if you want to prevent negative outcomes from happening. Now, the diagnosis is typically a multi-pronged lab approach that will suggest if there is endothelial dysfunction. The actual diagnosis pretty much lies in the machinery that can look at the endothelial lining through what's called autonomic nervous system testing. But in the lab, it's imperative that we get on pretty much most of our male and female adult patients a C-reactive protein high sensitive, which will pretty much determine if there's inflammation inside the arteries, a homocysteine level, which when it's elevated definitely increases the risk of having coronary artery disease, a plaque 2 test, which clearly shows if there's friable plaque, and the hereditary factors, apolipoprotein B and a lipoprotein a. Fibrinogen will give you an idea whether the blood is now becoming too viscous. And a GGT has also actually been shown, even though it's typically a liver test, to be associated with cardiovascular disease as well. Now, there's a simple test that you could do in your office. It's a simple little strip that the patient puts a little saliva on, and it will help to determine pretty much on the spot if there's nitric oxide and how much there is of nitric oxide as well. Toxic metals is another perfect example of something that will cause disarrangement of the endothelial lining. And that, again, is an easy test I like mostly a challenge test, but that's, again, a talk for another time. So what are the treatment considerations? Well, they should definitely include general measures like weight loss, stop smoking, stress reduction techniques, things you always think about. But for sure, you need to use some sort of substance to have nitric oxide repletion, bring that back. And no, I don't mean L-arginine. And again, that's a discussion for a different topic time. Vitamin C for vascular health, which usually is at least 3,500 milligrams or more a day throughout the day. Drinking enough water, because that keeps the blood viscosity in check. And either aspirin or other fibrinolytic agents such as a natural nattokinase or Plasmanex made from the natto bean. And in difficult situations, there's always the possible use that you have at your fingertips of anticoagulants like Xarelto. Methylated B vitamins will help reduce the homocysteine levels, and methyl donors along with it often give you the results that you're looking at, even for people that have an MTHFR gene deficiency. And I like, of course, the IV nutrient route. It has a lot of excellent ways of helping. It is a great adjunct to your oral program. You want more information? Please go to my website, Dr. Mitch Ghen, DrMitchGhen.com, and we'll be here for you again and again to help your patients.